Everyone, how's everybody doing today? I hope you guys are doing well. I hope your NCLEX reviews are doing okay. On this video, before I will proceed to do a quick review, I do want to have a quick chit chat with you guys. And I was thinking, a lot about a topic that I would want to talk about in this video. And I decided that maybe, finances in nursing would be an interesting topic that you guys might want to listen. And obviously, you could say that finances in nursing, might not seem synonymous, although, there's plenty of upward mobility, right? And in the career of nursing, right? And let's be clear, nursing can be a profitable career, right? And there's a lot of opportunity and chance of, making a good amount of money. But I believe that what a lot of nurses lack is, somewhat of financial knowledge of where they do allocate their capital or money allocation, right? Now let's begin with, I would say that one of the most important factors that can help lead anybody, not just nurses, to financial independence, I would say would be being debt free, right? Because if you really think about it, I think an average APR between 25 to 26% annual interest rate, right? It's very steep and it's very high. If you think about it, if let's say you owe about $10,000 or more, that's about 2,500, a year just in interest, right? So when the banks not really allows, but they do want you to pay the minimum amount, that minimum amount doesn't even cover the interest rate itself, more or less the principal of the amount. So even if you don't use the card anymore, even if you close the card in a couple of years, in several years, the interest rate still adds up if you're paying the minimum amount, and it can still double up. Now, the second factor that I think is very important is you guys, nurses, do need to take advantage of tax deferred plans, such as your 401k, especially if it's being matched by the hospital or any company that you work for. Definitely your Roth IRA or regular IRA, right? And even a 403b, which is a college fund, and even a health savings account. I think those tax deferred plans are very, very, very important. I think that the ability to deduct your taxable income, is a big advantage, right? Now, in regard to investing, I mean, whether or not you're young and you want to be aggressive, or you're approaching uh, retirement, which means you do have to be conservative. It is a good idea to just have a little bit of knowledge of, really, it doesn't have to be specific knowledge, but just an idea of how the investing world you know uh, works, right? What you guys, not just you know your 401k um, company that allocates your money, but really just understanding you know what it is that you're invested on, whether it's an ETF or an index fund, or no, I believe you stay away from individual stocks no matter what the hype is. But there are plenty of apps, uh, and and companies that allows you to self allocate your funds, whether or not it's in a 401k or a Roth IRA. And there are very I believe that mutual funds have a very steep um, um, fee. Therefore, I would suggest to stay away from it. But there are plenty of what we call index funds or ETFs that really invest on the broad market, right? So it's very, very conservative and very, very safe, such as Vanguard. So, I do think, and I don't want to bore you guys with all that stuff, but I do think that knowledge is important. Financial knowledge is important. Get debt free. Take advantage of tax deferred plans and try to avoid lifestyle inflation. Lifestyle, I think at some point anybody goes through some kind of lifestyle inflation. It's just human nature, right? But you know, um, you do have to be mindful because the game is about savings rate. Okay, um, the game will always go down to savings rate. Um, you can, you can own a big mansion, couple of Lamborghinis, but at the end of the day, it's all about your net worth, right? And cars depreciate, and if you didn't put, no less than 20% down on a mortgage, right? And you're borrowing, a lot of money from the bank, the interest rate still be very high. So definitely, definitely, definitely monthly savings rate, you should be mindful about, um, because that is your, as Dave Ramsey would have said, that that's your biggest shovel, right? Is your income and your savings rate. So that's it for this talk. I just wanted to keep it short, less than 5 minutes, but it's already 6 minutes. Stay away from lifestyle inflation, guys. So on that note, uh, we are going to go ahead and do our review. Hey guys, so I'm so sorry that the screencast on my computer is not working very well, so I will be doing it old school style in this review. So, so in this review, we're going to be talking about tetracyclines. Specifically, we're going to be talking about the two most common um, medications that you'll most likely encounter in your exam, which is doxycycline or vibromycin and tetracycline HCl, which is penmycin. Okay. Now, basically, tetracyclines are bacteriostatic agents, right? That inhibits protein synthesis on the bacteria that they're acting on, and they're usually they're used for treatments of major STDs, specifically syphilis, chlamydia, and gonorrhea, right? And vibromycin, or doxycycline, is actually also the first treatment for anthrax. Okay, and also take note that with tetracyclines, a combination of tetracyclines is also the therapy to help eliminate H. pylori infection, right? Which is a gut bacteria that causes PUD or peptic ulcer disease, right? And also, tetracycline HCl or penmycin is also the drug of choice treatment for Lyme disease. Okay, now let's talk about side effects. Side effects for these two drugs would include glossitis. Now, glossitis is basically just inflammation or enlargement of the tongue, right? Also, dysphagia, difficulty swallowing, some diarrhea, and phototoxic reactions. Phototoxic reactions is like an immune allergic reaction, usually to the sun, um, and super infections. Now, super infection is also very important that you have to be mindful about because it's basically like a second infection imposed by the first infection, uh, which would then be resistant of the present therapeutic antibiotics. So that can be very harmful to the patient, right? So we do have to be aware of that. Um, Therefore, what are the nursing considerations for these drugs? They need to take these drugs an hour before or 2 to 3 hours after meals, right? And you don't take it with antacids or milk or any iron preparations, right? And understand that these drugs are very, very highly nephrotoxic. Therefore, you do need to monitor the renal function, your BUNs, your creatinine levels, right? And understand the biggest thing with tetracyclines is that it can lessen the effect, or what we call the efficacy, of oral contraceptives, right? So therefore, we need to educate our patients that they do need to use other contraceptive methods, right? Um, in addition to just oral contraceptives. Okay, so that's it for now, guys. I just wanted to go over tetracyclines with you. We had a great talk today. You guys, um, I hope you guys will have a great day. Hope your reviews are going well. Stay safe. Don't forget to subscribe. I will be doing more of these talks more often, and I hope you guys have a blessed day. Appreciate you guys. Thank you. Bye bye.